Thousands of Americans each year receive hip replacement surgeries, and although their pain may be relieved, physical activity is somewhat restricted. Fox 40's Jacqueline Kane tells us about an alternative to hip replacement that allows patients to move around like they're young again.
Robert Krowiak is a gym teacher in Maine Endwell High School.
Good turn.
It's a job that is physically demanding, and for many years he hasn't been able to perform to his best ability because of a hip injury he got 18 years ago.
I had people tell me, why am I limping? I'd have people tell me I'm dragging my leg.
But finally, he decided to find some help.
When my 7-year-old niece beat me in a running race, I knew it was time to do something.
He did some research and learned about hip bone resurfacing surgery, an alternative to hip replacement, and found a local doctor that performed the surgery.
This is a representation of half a pelvis.
Dr. Michael Clarke is a surgeon and a hip and knee specialist who is experienced with the resurfacing procedure.
I've been doing it for 10 years. I trained in the UK, and I remember initially doing a case with my then fellowship trainer back in 1996.
Dr. Clarke says although the two surgeries sound alike, there are significant differences.
In a hip replacement, the top of the ball and the neck of the thigh bone at the top is removed, and the inside of the thigh bone is cored out to place the metal stem. In a hip resurfacing, the top of the ball in the thigh bone isn't removed, nor is the neck. The top is just shaved down so a metal cap is placed on it. So it retains much more of the patient's own bone.
Resurfacing also has other benefits.
The cup is bigger, and when they cap the femoral head, they literally sand it down and cap it. It's less apt to dislocate, and which works for younger, more active people.
And while many people struggle with physical activity after hip replacement surgery,
patients with a hip resurfacing, because it is much more stable and a more rugged device which retains more of the host bone, I'm pretty much happy at 6 months after the surgery to say go ahead and do what you like.
So what does Krowiak think of resurfacing post-op?
It's wonderful. As a matter of fact, the hip's like a 25-year-old, and the other side is like a 51-year-old.
Over 60,000 hip resurfacing surgeries have been conducted since 1997, and perhaps resurfacing may be the new replacement for hip replacement. In Binghamton, Jacqueline Kane, Fox 40 News, First at 10.